for the opening statement. Maternal and child health survival, a decade of progress and action for the future. And as we celebrate this International Women's Day, we know that if you support a woman, then you're promoting progress. I also chose to use this cover of a book called Where There Is No Doctor. This book has been read by millions of people because people get tired of, lining up in the hospital. And so they really, really would like to, find a solution. Where there is no doctor, what can I do? We know that women seem strong, even when everything else seems to be going wrong. My mother was a nurse, and I can tell you, for every single flu, cough, or fever, she gave me medicine. She gave all of us medicine. And we received a lot of injections, maybe some of which were not necessary. To this date, as a pediatrician, I hesitate to give children injections because I know how painful they can be. We know how mothers struggle with giving children syrups. And I know the mothers in this room know this big spoon and a brown bottle that contains syrups. But mothers also may use herbal concoctions to treat the children. And the best treatment that mothers can give is to pray. Sometimes the prayers may not seem fruitful, and sometimes they are actually successful. But whatever it is, women seem strong when everything seems to be going wrong. The importance of a mother in a child's life cannot be overstated. Mothers are vital in shaping their child's character, providing emotional support, and nurturing growth and development. And being a mother is the most important role that a woman can ever play. Mothers play a huge role in their children's lives, caring for them, loving them, teaching them, making sure that they are healthy, and so much more. And the way a child develops can largely be attributed to the role that their parents and their caregivers play in their lives. So fathers on this call, you're not left out of this discussion. A child ideally should be taken care of by both their parents. And this caring starts from the time of preconception. I know I have previously spoken to the ICPAU about preconception and how you can even now decide on which sex of baby you should have, the timing of pregnancy. Some people have reached the extent of deciding how many babies they should, impregnate in their bodies using IVU. And technology is changing every day. But if we are looking at natural conception, the preconception period is 60 days before you actually become pregnant. That is the time when you should start planning with your partner, your spouse, and also start relaxing and taking your folic acid tablets, because as a mother, you're going to be the house for that baby, and your house should be healthy. After conception, then the first trimester starts. Dear friends, this here is not a tadpole. This is a little baby. And as the baby grows and is given birth to, the baby should cry. Crying should happen in the first 3 minutes. If a baby does not cry, then we worry that that baby did not get enough oxygen to their brain and that they may actually have problems growing up. This is a quotation from John F. Kennedy, that children are the world's most vulnerable resource and its best hope for the future. So, why am I bothering you with preconception, conception, first trimester, birth, first 2 years? Because these are the critical first 1,000 days in the continuum of life of a human being. It starts with the prenatal period, then the antenatal period, and then as the child grows to 2 years, a lot of things can happen. I acknowledge Linda Aldea, who shared this slide. We know that every single day, millions of parents seek health care for their children, taking them to hospitals, health centers, pharmacists, doctors, and even traditional healers. In Uganda, we know that nearly 80% of our population first visits a traditional healer before even going to see us as doctors. Parenting is special, but it takes a lot of effort. And a woman's health is her capital, and her body hears everything her mind says. If a woman feels that her baby is not well, baby is not breastfeeding, baby has developed a fever, then she will respond by either giving paracetamol or giving extra fluids or giving a concoction or a tincture and then taking that baby to the hospital. I'd like us to reflect on some definitions. A preterm is any baby born before the age of 36 weeks. A newborn baby is one that is 0 to 2 months old. And an infant is a baby below the age of 1 year of life. A toddler, those children who struggle to walk, are aged between 2 to 3 years. And then there's under 5, and then adolescents, who are my special thing, are 10 to 19 years. And then a young person is 10 to 24. I know that in Uganda and many other places, people still call their children children, even when they are adults, even when they are elderly. And I know that mothers in this room will continue to call their husbands my firstborn, my baby. But also we know that if that special baby, your husband, is not healthy, then the entire home is not healthy. So these are just quick steps of milestones that as a baby is born, they should be able to breastfeed. They should be able to smile when you touch their side of the lip. And those are primitive reflexes. But as a baby grows, the baby goes through various milestones. They learn how to play, they learn how to crawl, they learn how to walk. And as they grow older and older, we do something called a developmental assessment. Lo and behold, if that baby is not developing properly, there'll be a lot of fear and challenges in the home. And so we need to support mothers and fathers as pediatricians, as doctors, to do a developmental assessment. If a child, for example, is not talking by 2 years, let us do a hearing assessment. If a child is crying excessively, let us find out if that child is maybe having a condition called autism, or if that child is unable to talk, what exactly is going on? There are things that we can do. The first 28 days of life are the neonatal period, and it is the most vulnerable time for a child's survival. Look at birds and animals. I know you can hear a bird in the background. But animals, as soon as they are born, they're able to fend for themselves. A baby lion will be running around trying to see if it can eat some, breast milk and then food. But little human beings are so delicate. And it takes a lot of time for our babies to even start to walk and fend for themselves. Children, unfortunately, face the highest risk of dying in the first month of life. In Uganda, the neonatal mortality that was originally 51 per 1,000 babies born in 1990, but it has gone down. We are not yet there. In countries like Japan, the infant mortality rate is 0.6 per 1,000 live babies. So we still have a lot of catching up to do. And what do children die from? They die from brain infections, they die from HIV, they die from pneumonia, they die from tetanus. On our ward right now, we have 2 babies with tetanus, and tetanus can be prevented. So we need to start on a good note. Imagine if you're a long distance runner, and then you fall at the beginning of your race. you will not complete that race or you will not win the race. So as we grow up at our children, as we bring them back, as we nurture them, we must make sure that the first 1,000 days of life catered for. Neuroscience, that is the science that deals with the brain. It is linked to good nutrition in the first 1,000 days. Remember, mom has to eat well 60 days before she becomes pregnant, and then subsequently, the feeding has to be good until at least 2 years. The mother's mental well-being. Mothers who are abused, beaten, the baby will also be stressed in the womb. And then parenting, the quality of relationships, the attachment of love and respect and a good life to that baby are going to determine the mental health of the baby. Then stimulation in a safe and protected environment, and the 4 building blocks that impact early childhood development, including immunization, ensuring that we take them to monitor their growth and development. Then toxic stress and vulnerability all impact on the brain growth of a child. And if a child's brain does not grow well, we know that that child can never become an influential person in our society. So it's not just about food, it's beyond food. We know how stress and nutrition interact with each other in the first 1,000 days. And this is just an example that if a mother is stressed, then her baby too will be stressed. And stress can impact on the health of the baby, even as an adult, including that babies who are stressed are not going to grow to their fullest capacity. They may be very small babies, and later on in life, they're the ones that are going to be at risk of developing hypertension and diabetes. And a combination of hypertension and diabetes later on in life can result in early or premature death. So this is just an example that if a mother is smoking, for example, it's going to hurt her baby. If a mother is drinking excessively, a lot of alcohol, more than half a glass, or drinking lots of Agenol or whatever, they are going to affect the life of that baby. So babies who have a warm, loving, responsive care in the first few months of life, they develop empathy, they are able to deal with emotional and social stress, and also they have emotional and mental tools to have a good relationship with others. Imagine an accountant who is emotionally unstable and is yelling at their customers and is yelling at the people they work with. The numbers are going to get jinxed. So we need to start from a good beginning. As excuse me, my internet went off. Please tell me if you can hear me.
Yes, we are hearing you.
Okay. Sorry, the internet went off, so I'll just keep going on. Let me know if you can still hear me.
Yes, we can hear you.
Oh, okay, all right. So as I was saying, if an accountant is not emotionally stable, they could get jinxed in their accounts and then they'll be reported to the auditors and it will become a real crisis. So I've been talking for a long time and I'd like us to take a deep breath, breathe in, breathe out, relax. For some of you who can stand up, please stand, stretch your legs. And then we can continue to look at prevention options for children under 5. These key interventions have been known to reduce death, early death before the age of 5. And please remember, there are just a few things. Breastfeeding from the time the baby is born. The mother's breast milk contains antibodies that can support the health of the baby. Using insecticide-treated bed nets or repellents from malaria, giving zinc to the baby when the baby develops diarrhea, and then complementary feeding when the baby is 6 months of age, and then having good water and sanitation, and finally hygiene. If a baby becomes ill, the treatment, for example, if they develop diarrhea, includes giving
Richard, we seem to have lost the voice.
Sabrina, you are muted. Dr. Sabrina, you are muted.
Sorry, we have unstable internet here at Mulago. Can you see my slides?
Yes. You can put in a full slide show. You're welcome back.
Okay. It's in slideshow. I hope you can see the slides.
Yes. Yeah. Perfect.
Okay, so I was saying that mothers are the first doctors. Mothers are the doctors when the children are in the womb. Mothers are usually virtual nurses, when they are breastfeeding this baby. Mothers love cleanliness. I know fathers love cleanliness too. But when a mother cleans the house, she's scrubbing, she's dusting, she's actually doing the job of being a healthcare provider for her home. And then mothers listen. They listen to the baby's cry. A shriek is sharp or continuous. The baby may need a change of diaper. And then mothers have a sixth sense. It's called intuition. And mothers can tell you that they have a feeling that something is not right, that maybe this baby should not go to school that day. And many people think that doctors are magicians, but I think that mothers are magicians as well. Mothers from the time immemorial, they stand out as a special kind of people. You can call them super moms, you can call them superheroes, superstars, but they are definitely humans with feelings. They get tired, they get exhausted, they get overwhelmed. And applauding our positive contributions as mothers will support us to rejuvenate and reinvigorate our energies. So this is our day. I know that many people have been saying, why do they celebrate Women's Day? Why do they promote mothers, etc.? But it is that just one day where we celebrate women, encourage us to become reinvigorated so that we remain the doctors in the house. If you have a newborn baby in your house, it is important to avoid accidents. Accidents are the biggest killers of children and young people. And every year, 450,000 children below the age of 5 years end up in the emergency unit because they've swallowed a coin, because they've swallowed a toothpick, because they've put a bean in their nostrils. I once received a child who had put a crayon in their nose, and the poor teacher was running all over the place because she couldn't hand over the baby back to their parents. So we need to be safe. And how can we be safe? It is important to make sure that accidents do not happen. As you plan to have that baby, as you plan to have that child in your house, these are simple steps that can give you a peace of mind and help children to be safe. Get down on your hands and knees. Make sure that there's nothing creeping or crawling or rolling around. Notice any sharp edges, dangling cords, bottles that contain fluids or chemicals that a child can swallow. Make sure that all medicines are out of the reach of children. And also, as we continue to use electricity, please make sure that your plugs are safe. For those of you with ladders or stairs, make sure they are fitted gates so that babies don't roll over or roll out of their beds. And when a baby is having a bath, please be present when that baby is having a bath, because children can quickly suffocate and die. I already mentioned this. Liquids, laundry soap, capsules, they can look like sweets to babies and they can easily be swallowed. Let us hold the furniture in place. If this cupboard fell on a baby, that baby could easily lose their life. So let us be careful. And then I mentioned when you're feeding the baby, giving them food like tomatoes, grapes, blackberries, whatever, cut them into small pieces. Babies are not like us. They can easily choke. And the other thing is, don't force feed the children. Forceful feeding, dear parents, can cause choking and death in a child. So, the care of a child and learning starts during pregnancy. Empowering mothers and other caregivers is essential in bringing up our children. The education of a mother starts from when that mother is a child. And there's a huge relationship between the economic rationale for providing support to mothers during pregnancy and early childhood. And research has shown that providing support and care to mothers and babies during pregnancy and early childhood is 5 times more effective than any other intervention. The most important day of a person's education is not the day they graduate from high school. It's not the day they graduate from a PhD. It's actually the first day at school. But as that child goes to school, in what condition are they? Are they fully immunized? Are they vaccinated? Are they healthy mother who is the first doctor in the home to ensure that the baby is fully vaccinated, to ensure that that baby has a meal, and to ensure that that baby is emotionally stable to even start school? Dear fathers, this is the time when I'll tell you that it is of cost benefit to marry an educated woman. It is also of cost benefit to marry a woman who is intelligent, because the more intelligent the mother, the more intelligent the baby. We know that 70% of the brain is actually passed on from mother to child. So for those of you who choose to have, uneducated mothers for your children, think again. But also to resolve this, I think that every woman deserves to be educated, because when you educate a woman, you educate a nation. Children thrive when they have a secure and positive relationship with people, especially their parents. And studies have shown that early childhood is a period in which developmentally a child is learning a lot from their surroundings and the people around them. So if a mother is not able to teach a child colors, to teach a child that this is an egg, it's going to grow into a chicken, etc., then the child's brain is not growing. I hope you get the point. We need to be close to our children. Research has shown that fathers who take off 1 week or more when their babies are born, they are going to have a closer relationship with that child as the child grows, even as teenagers or college students. I know that in Uganda, fathers are only given 4 days of paternity leave, and mothers are only given 3 months. But in developed countries like the Scandinavian countries like Norway, etc., we know how fathers are given until 1 month as paternity leave, and mothers are even paid to be on maternity leave for a year. And the outcomes are clear. I'll now talk about adolescents. 1 out of every 5 people in the world is an adolescent. And in our country, 1 out of every 3 people is an adolescent. Early adolescents are people aged 10 to 13 years, middle is 14 to 16 years, and late is 17 to 19 years. As girls grow, there are many changes on their bodies, and I want to thank Gloria and others who continue to bring your adolescents to us, to support them to grow, to help them understand that their bodies are changing. And boys also change. They get muscles, they get bigger. In some places, their voices change. We, as parents, we try as much as possible not to talk about sex and sexuality to our children and relegate this job to a singer. But we know that many singers are not even available, and sex education is limited. And according to surveys, Ugandan adolescents would prefer to get information from health professionals. However, parents, please teach your children about menstruation, teach your children about cramps. Fathers, be interested in buying sanitary wear for your wife and your daughters. This is an old flyer of our clinic. It runs every Friday. It's a free clinic. Please bring us your patients, bring us your children so that we take them through immunization. Immunization does not only stop below 1 year. We repeat tetanus toxoid at 10 years. We also provide human papillomavirus vaccine to girls between the age of 9 to 13 and even older. I talk about tetanus with a lot of passion because over the last 3 months, we have lost more than 10 children to tetanus. Fathers in the room, if you have not been vaccinated for tetanus, please go and get your vaccination boosters. It happens every 10 years. I know that mothers, when they are pregnant, they are given their tetanus vaccines, but I'm calling on all of us to be responsible in a healthy way. Of course, health cannot be separated from security. Children need to be safe. Children need to come from stable families and stable communities. And also, there needs to be consistency. There's always a discussion of good cop, bad cop, daddies wanting to be the good cop, and mothers generally being known as the bad cop. But let us be cops together. It's important. And also to have emotional support from parents. As children go through exams, they need to be encouraged, comforted, and then to be loved. Saying and showing that you love your children can overcome almost any parenting mistake that you make. And hugging your child is actually going to give them better immunity. If you have not been hugging your child, dear parents, please hug the children. And then education, I cannot overemphasize this. Let us educate our children so that they will be the future for tomorrow. I'm about to finish, dear Chair. Young children's health development depends a lot on nutrition, safety, and security. And this is just a summary of everything I have said. As mothers, who are the first doctors in the home, let us monitor our children's growth by looking at their weights as they are growing up. When they get diarrhea, let us give them oral rehydration therapy. For those who are pregnant, remember, the first golden hour of breastfeeding your child is going to determine whether they are healthy or not. And then immunization and family planning. Family planning means you are planning for the number of children you have in your home, and it may require using contraception. And then female education. Educating a woman is educating a nation. And obviously, there are other things like food supplementation. Every medicine that we need is actually in our kitchens. If you give a child an apple a day or a banana, you're giving them vitamin C. If you give your child a glass of milk, you're giving them vitamin D, you're giving them proteins. And also, if you give your first love, your husband, some garlic. So this is my take home for all of us. Children are our future, and we must nurture them and take care of them. If children are healthy, they will become healthy adults. Adolescents are unique, they are special, they are going through a transition period. But they need to be motivated and supported to make right choices. A broken boy is more difficult, or rather, a broken boy is easier to mend than a broken man. A broken girl is easier to mend than a broken woman. And people who are broken, people who are bitter, angry, frustrated, they are the ones who are likely to be corrupt and angry and all those things. So we need to listen to our children. We need to give them time to nurture them, and we should communicate with them in whatever way. Even if the communication is distant, then we have to use, for example, social media to communicate with them. If it has to be, so be it. We know that health is made at home. For us in the hospital, we repair the broken health. But as doctors, we are also moving towards prevention. There are now more non-communicable diseases than non-communicable diseases. So let your home be a place of comfort. Let your home be a place where health is made, including having enough sleep, a comfortable bed, making sure that you have a balanced diet, making sure that aerobics is part and parcel of your day-to-day activities. And we want to see healthy children. We want to see healthy families, and that is our goal. The ICPAU, the goal or theme for this World International Women's Day is action and forging women's economic empowerment, recruiting, retaining, and developing female talent, and supporting women in leadership. So I urge you to help women and girls make informed decisions about their health, make an informed decision about sustainable agriculture and food security, and ensuring that there's quality education and training for all women, but also all men. This is a sign, ladies and gentlemen, and I wish everyone could do it at the end, that we are promoting inclusivity. I'd like to celebrate these two ladies who came to my office yesterday, Irene Kulabako and Carol Amase, who is from the Ministry of Health. And it was a great celebration, just listening to each other and talking about the health of adolescents. Ladies and gentlemen, every child deserves to reach their fullest potential. Every single child deserves to reach their fullest potential. So as mothers, specifically mothers, Let us nurture our children so that they grow up to be responsible adults, but also fathers. Be champions of excellence. I wrote a little book, and this book has been bought by so many people. I want to thank them. It's called The Real Pursuit of Excellence. And at this time, I'm going to end and say thank you so much for listening to me. Back to you, the chair.
Thank you so much, Dr. Sabrina. It's never enough listening to you. I love the passion with which you always present and the passion you have for the young people. Not very many people want to deal with the young, but you always give them time. And yeah, CPA Derek Nkaja, you came in while the session had already started. And yeah, our CEO, he's very welcome. And he will, after our question and answer session, CPA Derek will give closing remarks. So without wasting much time, I think all of you have heard, that you should mind the intelligence of the woman that you marry, the men who have logged on. And you're always arguing when we talk that we are the ones who make. So therefore, I pray that all of us have picked many points and we shall be able to participate in parenting our children. For any questions, please type in the Q&A. There's the Q&A part of the chat. So for any question, please, let's have our questions in the Q&A. And let me, we are going to pick all the questions from there, from the Q&A. For some reason, I'm no longer seeing my Q&A. Ambrose, what has happened to my Q&A? I was seeing it, and now I can no longer see it. There was a question. The first question there was, someone said that you said that since childbearing starts 60 days before conception, and that with 60 days before one was planning to conceive, they should take their folic acid. And this person is asking that, what happens if I take the folic acid for 60 days and within 60 days I have not conceived? Do I continue taking or do I give up? So doctor, maybe you can meanwhile attend to that one. Ambrose, I no longer see the other questions.
Yes, Chair. There are questions. One is from Mark Kasibwe. He's asking you.
That was the one from Mark Kasibwe, the one that I have read.
Oh, yes. Oh, no.
Yeah, Mark is the one asking that.
A month old in-house.
No, not that one. So you read for me that one, because now I can no longer see it. I've read the one from Mark. What happens if they have taken folic acid for 60 days before conception as recommended, but after the 60 days that she has not conceived, should she just give up or continue taking them? Is there an overdose?
Yeah, thank you. Now, in addition to that, he also put in another one, that we have a month-old in-house, but she hates being covered. Yet we know they are vulnerable to colds. What can they do? Yeah, thank you.
Okay, the Q&A is back. Yeah, so we can maybe, let me read 3 so that we can have. So you've already done the, if you plan for conception and take folic acid but don't conceive after 2 months, do you continue and what are the dangers? And then if they have 1-month-old baby in house, this is another person, they have a 1-month-old baby in house who does not like to be covered, yet they know they are vulnerable to colds, and so what can they do? And also, is water good for a 1-month-old baby, doctor? As I said, you will have to forgive us as we are not doctors, so we are asking all the questions and you will have to answer all of them. So doctor, you can first deal with those 3.
Thank you so much for the questions. So if your wife has taken the folic acid 60 days before you assume conception and then the conception doesn't happen, there's no harm in taking folic acid every day, by the way. But if a person does not conceive that month, they can keep taking, especially if you're planning to become pregnant or to have a baby. I hope people know when to become pregnant. It's usually during the fertile period. So day 0 of the menstrual period, then you count 14 days, and that's the day of ovulation. But the fertile period is between day 11 and day 15 after your menstrual cycle. So the other thing is, as the lady is taking folic acid, I hope that the daddy is also preparing for his virility and healthy sperms and making sure that they are eating enough omega-3 and some garlic and some nuts, like, ground nuts and simsim, and energizing for that, act to happen correctly and safely. Then for the 1-month-old baby who hates being covered, we know that temperatures these days have been extremely high. At night, the temperatures were going up to 28 degrees. By the way, overcovering the baby makes them uncomfortable. It makes them sweat, it makes them hot. So maybe baby is communicating. The other thing is the baby could be uncomfortable with the coverings. If you are using wool and the baby is allergic and that is giving them like a runny nose and sneezy, that would make them become uncomfortable. So consult with your doctor and see what's going on with the baby. Should we give water to a 1-month-old baby? My quick answer is no, no, no. No mushroom soup, no beer, no alcohol, no water, just breast milk. We request that mothers exclusively breastfeed for at least 6 months. And then later on, they can start using the complementary food. Back to you, Chair.
Okay, thank you very much, Doctor. I do not know, you don't know what you have just done, but seeing some of the attendees on this webinar, all the Simsim ladies are going to sell. They are going to have over demand that is going to be too much. I could see a lot of comments when you told the men to eat omega-3 and Simsim and nuts. So I will not name them. They are here. I can see them laughing with the emojis of laughing. Thank you, Doctor, and also for having guided the ladies about the folic acid. Now, we have another one. This lady is asking, do we have centers for teaching first-time mothers to teach them things like how to breastfeed, how to hold the baby while feeding or bathing them? I'm going to read 3 questions. And then another one is asking, how do you handle an introvert adolescent? And the third one is, thank you, Doctor. When is the best time to give a baby formula? I think that one you have already answered it. You said after 6 months, especially for the working mothers. So this one wants solutions. Herman is concerned for working mothers who may not get maternity leave for 6 months. What solutions are there for them? And yeah, let's first have those 3. The questions are quite many. I think next time we need you for a whole day.
Yeah, thank you, Chair. Before Doctor responds, there is a hand up from Dr. Tony. Maybe, Chair, you will give him an opportunity to speak after the doctor answering these sets of questions. Thank you.
Oh, okay. So, Dr. Tony, your hand is up. I think he can unmute himself. Yeah, Dr. Tony, yes, you're welcome on this panel. You can also say something. Okay, meanwhile, Dr. Sabrina, since Dr. Tony is not yet unmuting, you can be answering the questions. Is there a place where you teach young first-time mothers what to do, okay, to hold the baby, to breastfeed? And also, Herman wants to know if his wife is working, how, at what time can they give baby formula? And the Birunj is asking, how do you handle an introvert adolescent So you can be answering as Dr. Tony unmutes himself. Dr. Tony, you'll speak immediately after Dr. Sabrina.
Those are really interesting questions, and I appreciate them. Now, for the centers for teaching first-time mothers, I believe there are people who are starting this project because there's a gap. First-time mothers, sometimes it's overwhelming. They don't know what to do. Previously, our mothers-in-law and our own mothers would come and teach us and support us. But these days, people are busy. We now are going to be the future mothers or mothers-in-law, and we may not have the time to teach our children exactly what to do. So there's a gap. And as business people, I think, prepare and plan for starting these centers. I know that during the antenatal clinics, this is a time when people should be taught what to do, how to attach the baby, and ask whatever question you can from the midwives and just be prepared. There are also books. There are many books in Aristoc, for example, where you teach mothers what to do. And then there's the Google Doctor. But please don't turn yourselves into doctors. It takes a minimum of 18 years to be trained as a doctor. So have a go-to person who you trust and people are willing to support you. I know that, and I answer the question of formula and that question. There are mothers who cannot breastfeed, and also there are babies who are allergic to breast milk. So if your baby is allergic to breast milk or you have zero milk, there are mothers who fail to totally get breast milk. Then those are the ones where we use formula. If a mom sadly passes on, we know that 16 women die during childbirth in this country on a daily basis. Those are babies who may need formula, and formula can be given from day zero. There's age-appropriate formula, and that can be discussed with a pediatrician. So, if you cannot get leave, you can still breastfeed your baby. We know that now there are breast pumps. You can pump the milk and store it in the fridge for up to 6 weeks, and it will still be viable. So mothers out there, don't be afraid. You can still pump this milk. I also urge that the ICPAU should be, I challenge you to open up breastfeeding spaces where mothers can come with their babies and breastfeed. We did a study recently with my colleague, Dr. Joseph Rujumba, and we found that in this country, very, very few organizations have places where mothers can breastfeed their babies when they go with them to work. So let us challenge what is the abnormal. The normal should be that mothers should be given a chance to breastfeed and they should be supported. Now, an introverted adolescent. I don't know who asked this question, but I want you to reflect on when you yourself, you were an adolescent. What about the other parent of this child? Were they introverts, or what went wrong? We sometimes expect our children to be very different from who we were, because that's the genetic makeup. But also, if an adolescent is very quiet, they are not talking to anybody, they may be depressed. And if this situation continues for more than 2 weeks, please seek medical advice. We have seen adolescents who are so depressed and they actually end up hurting themselves. And we've known that some adolescents even end up committing suicide. So if your adolescent is behaving abnormally, they are talking to themselves and giving themselves advice, they are sleeping irregularly, they may be doing drugs, please talk to them or consult with a provider. You could save a life. So over to you, Dr. Tony, and I hope I've answered your questions. Thank you.
having some challenges. I hope admin will help him on the sidelines to be able to mute, unmute. But in the meantime, there is a question repeated in different words many times, and that is from the mothers. You know, these accountants you're talking to, they are working mothers, and they are saying sincerely, how do they balance motherhood and also be working? And then one saying that for children under 3 years, doctor, how do you advise the mothers to be able to balance and work? And one is saying, working mothers try to balance it all, but they end up breaking emotionally. What advice do you give the working mothers? But Job has a specific question, doctor. How do I decide the sex of the child my wife should conceive? Over to you, doctor.
Thank you so much for the questions. Now, balancing motherhood and work is a question that is continuously going to be asked. But we need to understand that the clock, the biological clock, ticks very quickly for women. For men, it's the financial clock. For women, it's the biological clock. For us as women, we should aim at giving birth to babies before the age of 35, and we close that chapter. The older you grow, after 35 and you're busy giving birth, the higher the risk of you giving birth to a child with abnormalities. So try your level best to do off with childbirth before 35. And after 35, the bones also become brittle, exhausted. There are challenges. So let us try as much as possible to do the birth giving before. And also, I know that today there are banks that are storing eggs. If you are approaching 35, you've not yet storing some eggs for the future. Because these days you can have a baby using a surrogate mother, you know, but do store those eggs if you've not yet given birth. Now, in terms of balancing the act, it's important to get people who support you. We know that we have house helps and we should treat them properly and respectfully, because if you do not treat your house help properly, they may, end up giving you a hard time with the children. Get people who are socially connected to you, your friends, your peers, your family members, your spouse. Share the work. You don't have to sweat it all alone. We know that men are out there hustling, making money, ensuring that they have enough money for their families, but also women are working. And so for a family that has 2 people working, it's a more comfortable family. You can afford a vacation, you can afford to be on leave for a longer time, but we should also look at our workplaces. Let us make our workplaces a happier place. If you have a boss who is toxic, you're not going to work well, you're going to be angry at work, you're going to be scared, you could end up being depressed. So we should improve our workspaces and perhaps include things like fun time, creativity, ensuring that we go for team building so that the workspace becomes a better place. Whatever we do, as you prioritize balancing home, work, being a leader, being a whatever it is, remember, your family comes first. Long after we are retired, we are going to go back to our families. And you don't want to be the kind of mother or father who did not make friends with their children. Because if you do that, then you're going to be a very lonely old man or a lonely old woman. So think fast, think ahead, and I pray that everyone has a well-balanced life. Find your me time. You can break your back and be a multi-purpose mother who cooks, who feeds, who does this, who does that. But at the end of that day, you can actually substitute some of those things. You don't have to cook all the food. Sometimes you can order out. You don't have to stitch the clothes. You can hire a tailor, you know? Gone are the days where our great-grandmothers were like full-time housewives. Today you have to balance being a teacher, a mother, a chef, visiting your child at school. But just know, the more quality time you give to your child, the better the outcome of that child. Now, I hope I've answered those questions.
Yeah,
Oh,
thank you,
yes.
Doctor. You have,
I did
yeah,
answer
you
Job's
have,
question.
yeah, Job is saying,
The
how can
question
he
from
decide the
Job.
sex? Yes, he wants to know how can
So
he
this
determine the
advice is
sex
on the
that his wife will
assumption.
conceive. Mm.
This advice is on an assumption that Job has a healthy sperm count, is eating enough sim, eating all the groundnuts, and his wife has no infertility problems, and she has a regular menstrual cycle. So usually we say that if you want a girl child, you will have sexual relations 2 to 3 days before ovulation. Remember, we said that ovulation happens on day 14. So the sexual activity has to happen on day 11 and 12, so that the egg sperms are the ones that stay in the fallopian tube, ready to fertilize the egg. And that will be a girl child. On the other hand, if they want a boy child, then they should plan to have sexual relations only on day 14 and day 15. Because the Y sperm, which makes the boy child, is very light and it swims very fast. And most times, 99% of the time, if you have sexual activities on the day of ovulation, you are likely to have a boy. So good luck, Job, with your next plan. Thank you.
Thank you so much, Doctor. As I told you, the topic that you are touching is at the heart of everybody, so you will have to bear with the very many questions. And I think Jackie has been answered, because she's saying, how do ladies who want to change the children's sex go about it? Especially if she's only giving birth to only boys and wants to give birth to a girl. I think that one you have answered. Albert is asking, how best does one handle a baby whose mother dies during childbirth? And Rita is saying, what happened when a woman gets hyperemesis gravidarum during the pregnancy? Can a child get the nutrients? Isn't their neural makeup disturbed? Don't the children get mental issues? Indeed, Doctor, I think we shall have you another time, because I don't know how many more hours they will give us. But the last question for this round for you is, what causes persistent skin rashes in children aged 3 years? Also stomach aches after eating, even when they seem fine. So you're going to, I think the other one for Rita, of if the sex instead of giving birth in a way, after giving birth, what do you advise? Because now
Sorry, CPA Gloria, if you could repeat the last question.
they can't breastfeed, then maybe we can look at the what causes the persistent skin rashes.
So can I answer the questions?
Yes, please.
If a mother dies during childbirth, unfortunately, that is a really, really tragic thing. And a child who loses a mother at birth can be really an unfortunate event. Obviously, the father needs counseling, the father needs support, and they can get a wet nurse, not a nurse who has had water poured on them, but there are people called wet nurses, maybe the sister of the mother, the grandmother, because breast milk is vital. The other thing is today we have breastfeeding banks. I know Tracy Ahumuza is, she has a company called Ati, and she supplies breast milk to babies, especially those who are preterm. And you can get the breast milk. But if that is not possible, the baby needs to be given formula so that they can survive. And we need to have a woman in, we fathers can bring up these children, but it can be a lot. Women release a hormone called estrogen and also progesterone. And these are hormones that nurture. It is known that children who are brought up only by fathers, they may be hard kids, and not soft spoken, not gentle, not this, not that. Not that you cannot have a single father, you can, but the preference is to have a mother. For hyperemesis gravidarum, I know we said we should excessively, and it can happen. Hyperemesis gravidarum can happen in mothers who are carrying multiple babies, twins especially, or more, or if they are unwell, or it's just a condition where they just keep vomiting and vomiting. That can cause dehydration. It can cause the mother to lose important elements in her body, and it can hurt the baby. So hyperemesis gravidarum is a condition that needs to be treated by the obstetrician, and it is an emergency. It can be because of malaria, it can be because of various things, but it needs to be treated urgently. For the baby who has repeated rashes can be because of a viral infection, they can be caused by eczema, but most likely eczema. And eczema is an allergic condition. So you want to remove the allergen. Usually it is the soap that the child is using, or some families are used to using powder. They put powder on the baby and the baby reacts. There are adulterated lotions. So if you're putting something on your child's skin and the child is getting a rash, the common sense would be that you stop using that particular lotion or soap. If it doesn't stop, then your doctor will prescribe an emollient or a mild steroid to treat the baby. For babies with recurrent abdominal pain, that is an entire topic we teach in psychosocial discomfort. It may be because the child is being bullied or abused. Recurrent abdominal pain can also be caused by peptic ulcer disease. So if a child has recurrent abdominal pain, please take them to see a doctor. Make sure that they get the correct investigations and treatment, because it can be an anatomical problem. A baby who gets recurrent abdominal pain may be allergic to certain foods. And one of the common foods that we don't usually consider is gluten. And gluten is found in wheat, it's found in maize, and children can be allergic to this. So if a child repeatedly says, after eating this food, I get a tummy ache, and you keep giving them the food, you're going to cause gastric irritation and gastroesophageal reflux disease, and the child will be uncomfortable. So listen to your children. Listen to them. You're the first doctor in the home. You know what happens to your child when they eat certain foods. And us as the doctors, we shall help to treat the child. Thank you.
Ambrose, thank you, Dr. Ambrose. I'm relying on you to tell me when we are left with very few minutes, so that maybe the rest of the questions we shall type them.
Yeah, we still have
and
time,
Doctor will answer. We still have time. Thank you. Okay, so Doctor, as I said, today you have come and the people have their questions. So one is asking, how can you ensure that the baby resembles the parents? That one you will answer, Doctor. Don't worry about our many questions. And one is saying, you have said that men should marry educated women, but some illiterate women produce bright children. I think what she said was that intelligent women. So maybe intelligence is not necessarily the level of education, but Doctor will explain it further. And they're asking what home remedies can be used to treat cough and colds in infants. And one gentleman is asking on this Women's Day, do men take folic acid too? And I think Doctor already told the men what to take. Go and befriend the Sim lady, Sarah, the one selling nuts, and buy the other supplements, as she said. And then saying that should it be, the other one is that what is the right age, Doctor? What physical development signs do you see in children for one to have the sex talk? So this person wants to know at what age or at what stage of development of their child should they start on the sex talk? And maybe we can first deal with those.
How I wish my students could ask so many questions like you guys. I continue to celebrate you and I'm here for you. I'll answer all the questions. So thank you so much. So how can you ensure that the baby will resemble both parents? Resemblance is a genetic thing. Unless, of course, we've previously had a discussion of DNA that actually about maybe 6% of the male population is infertile because they had mumps when they were growing up, infertile because that's how they were born. And the poor lady is so scared to belittle this man and say he cannot father a child, and she gets an assistant. There's all these things happen. However, in order for you to resemble your child, I guess it has to be your child. But resemblance does not only stop on the physical features. I know that the tendency is for people to marry people who they are attracted to, and that is a natural thing. People want to marry people who are taller. People want to marry people who are soft-spoken, but also people want to marry people who are of a certain class. People who are aristocratic may want to marry in their same classes. People who went to particular schools, the traditional Ivy League schools, want to marry people from the same class. Accountants may want to marry fellow accountants so that you all become rich together. So I don't know exactly what you meant by resemblance. It could be resemblance of attitude, resemblance of behavior, but if they are physical features, it's a genetic issue. Thank you. Thank you, CPA Gloria, for elaborating on intelligence. Intelligence is of various forms. It's emotional intelligence. It is cognitive intelligence. It is academic prowess. It is meritocracy. It's a lot of things. So to marry a woman of good intelligence, a proverbial woman is a woman of Proverbs 31, who will nurture you, who will grow you, who will groom you, who will celebrate you and respect you as a man. And that's the kind of woman you want to marry. A woman who will be a homemaker, a woman who will know that the child needs to go for vaccination, a woman who will know that it is important for children to go to school, all those things. So what are some of the home remedies for preventing cough or treating cough? I know that, drinking lots, hydrating specifically, like drinking lots of juice, drinking a warm drink. We usually used to joke with my mother. She would say, if you have a cough, I'm going to slaughter the only chicken in the house, and then you drink chicken soup. But today we know that, you can buy chicken soup from Java's Cafe. You can buy chicken soup, which is already powdered and commercialized. Or you can just, have warm water with egg in it and just boil it because you're looking for the protein, you're looking for hydration. Vitamin C is a good way to treat a cough and cold, a common cold and cough. So like I said, sharing grapes on the chart. So it's important for us to appreciate that our kitchens have a lot of these things. Even tomatoes have a lot of vitamin C. So you can make juice out of them and just feed the child. That's a lot of vitamin C. When do we start the sex talk? It's usually something we call the birds and the bees. Some people make a big drama out of it. The child turns 10 and on their birthday, they are busy telling them, don't have sex, don't this. They are bombarding them with a lot of information, which can be shocking. So the story of sex should start much earlier, actually. For example, if a child is 3 years and they are asking you, why am I different from my brother? That's a sex question. You need to tell them you're a girl, he's a boy. They could also ask, where did I come from? And you want to tell them that you came from your mother's womb. Please don't lie to the children. Whatever you do, do not lie. Because when they find out the truth, they are going to start not trusting you. If you tell a child that they were bought in a hospital, or you found them in the house when you built it, they're going to start wondering if they are your children. As the children grow, you should give them age-appropriate information. And the Ministry of Health, together with the Ministry of Gender and the Ministry of Education, they released the Sexuality Education Framework for parents. Please take time to download this very important book so that you know some of the tips of what to say, when to say it. But surely, by 10 years, that conversation of let's be clean, let's wash your panty properly, let's bathe 2 times a day, brush your teeth, comb your hair, should have already started so that you're building on it when you're talking about sex issues and you're not just coming like a stranger to talk about intimate things. Thank you.
Thank you so much, Doctor. And yeah, as I told you, thank you for saying that we can ask as many questions as possible, because the questions that are coming, as you can see, show that indeed everybody is very interested. Ruth is asking, can someone of the autism symptoms be outgrown? Can some of the autism symptoms be outgrown as the child grows? In other words, can it go away? Okay, in case, and many want to find your book, and indeed we are going to. Even we will. I think we can have some maybe at SPAO, but I think it's there at Aristoc, and so the other one is. Thank you very much, Doctor. You said that it is not good to feed babies forcefully. How can we encourage them to eat without force? And someone is saying, accountants tend to put a lot of time into their work at the expense of their children or families. And this is true, Doctor, by the way. The people you're talking to can work up to tomorrow. Some of them will go back to their homes tomorrow. They are in office working and balancing. And so she's saying, how can you advise them about the risk of their absence from home. And then Sheila is asking, you have indicated that we should introduce complementary feeding after 6 months. The baby may not seem to feed to full satisfaction by 3 or 4 months. Sometimes the mothers are forced to introduce these foods at 3 months or 4 months. It's true, Dr. Sabrina. What's your comment on this? The mothers are still crying out. They are finding it difficult for the 6 month to do the 6 month breastfeeding. And another person is saying her babies, I think they are twins. Her babies are 2 years and they cannot make a sentence. Should she be worried? She has 2-year-olds. I think they are twins, but they cannot make a sentence. Should she get worried? Let's first take this.
Well, thank you so much. Now, we know that autism is a spectrum, and because it is a spectrum, there are some children who will have Asperger's syndrome. They'll be socially well-connected, but very interested in a particular thing. They may be interested in computers. They may be interested in numbers alone. They may be interested in a different language. I've seen a child who has autism who came to our clinic, and she's teaching herself Japanese. She can write kanji, romanji, and all those hieroglyphics of the Japanese language. But she's on the autism spectrum. There are children who have severe autism and they are not socially connected. They throw temper tantrums. They don't want to eat. They are complicated. And it is a whole big stress on the parents. Today, we know that there are trainings for children with autism to help them remain stable, to help them have attachment to parents who love them, and they will calm down. If you have an autistic child, a child with autism, find a way of looking for the positive in them. What calms them down? What food do they like that doesn't give them hyperactivity and irritability so that you can be supported? Do you have a counseling or a support system that makes you yourself as a parent not get agitated? Every one of us needs counseling, to tell you the truth. And there are so many counselors, but people don't want to pay the counselors. Seek help. Seek help so that you can be supported. If a person has autism or is on the autistic spectrum disorder, it doesn't go away. They don't outgrow it. But the training, which is occupational therapy, social support, psychological support, is what is going to improve their outcomes. So I know that accountants work really hard, super hard, and you're always balancing books, balancing money, some of you getting engaged in big fat audits, and then coming home with the money. But like we said, too much of anything is always bad. Try to balance between your work and your family. Get a holiday. I once talked to a group of individuals, I won't say who they were, but out of the group of 100 who I talked to, they all said they have never got a leave for the last 10 years. Like, what kind of human beings are those who don't take leave? If you do not take leave, your body is going to help you take leave. And by taking leave, you may get a stroke, you may get a hypertensive crisis. You need to take care of your bodies. Dear accountants, it's high time you became selfish for you. Get me time, free some time, and go on a holiday and just be with your children so that you rejuvenate, you come back feeling refreshed and more healthy. And most importantly, before I forget, we all need to go for a health checkup. If you lose your life prematurely, your children are going to suffer. So let us try our level best to be like our colleagues, the Japanese, who suffer from longevity. And they suffer from longevity because they can live up to 100, At 65, they are still being called young person, and they do certain things repeatedly. They eat a balanced diet, they eat an early dinner, they make sure they relax and they meditate, and also they exercise. So don't sit on your chairs for a long time. I'm even feeling uncomfortable. I need to stand up, exercise a bit, make it your practice to exercise routinely. But try to be home and be with your children. And even if you spend a long time at work, when you meet with the children, have quality time. Sometimes it's not the quantity of the time you spend with the kids, but the quality of the time. If you go home and the only thing you're telling the children is, you didn't clean this place, you didn't do your homework, you're shouting, your voice is raised. You're not creating love relationships. So speak calmly, learn what ticks you off, and remain calm. Now, the complementary foods. I know mothers get really anxious. The breast milk is not enough. It's not enough. But there are ways to increase the breast milk. The more you breastfeed, the more you hydrate, the more the breast milk. And the more you're relaxed while you're breastfeeding, the more that milk will come. The milk can come. There are certain foods that can increase breast milk. People have talked about fenestial seeds. People have talked about chia seeds, okra. All these things help to increase on the breast milk. Then for the 2-year-old twins who cannot yet make a sentence by 2 years, please don't panic. I want to reshare this slide. Oops. I want to reshare this. Can you see this?
Yes, we do.
Okay, I can't see it on my side, but if you look carefully at the...
Now it has gone off. We are no longer seeing it.
I don't know what has happened. The milestones are not set in stone. Some children may have delayed speech, and others will have speech from 8 months. It's a range. If a child is not saying a single word by 2 years, that would worry me. It could mean that probably they have not heard a single word all their lives and that they are of hearing impairment. If, however, they can say a few words, maybe they are not getting enough exposure to verbs and different words. So maybe these 2-year-olds should be taken to a daycare center. Maybe it is time for the cousins and the other little children to come and be with them so that they learn. And maybe they shouldn't be exposed too much to screen. Some parents have turned the television into their co-parent, and the child is not understanding what these people are saying on television. So if the children don't say a full sentence by 4 years, then we should question. But if they are saying a few words, don't panic. Thank you.
Thank you, Doctor. I think this is the second last set of questions that I am bringing to you. But someone is saying that, okay, this is just a comment that today's mothers complicated the reading. I think you've talked to that very much. And one parent is asking, thank you, doctor. Please provide guidance on the appropriate time to introduce gadgets for babies, okay? And then, so what is the appropriate time to introduce gadgets for babies? And the patient is asking, cramps are so painful. Is it true that after giving birth, the pain reduces? Is there anything one can do to reduce this pain? I hear painkillers are not advisable. And there is this thing from Joanne. There is this thing called Omusuja Nakawere. I hope, doctor, you know this one. I have just seen it today. How best can someone avoid it? Because it almost killed me after giving birth. And the other one is saying ICPAU. Whenever we are doing exams, you have an ambulance on ground instead of breastfeeding space. Why don't you be giving breastfeeding mothers time between exams and more time so that they can breastfeed? CPA, a few council members are here, and the CEO is also here. We will think of what we can do for our breastfeeding mothers. Okay. In Uganda, many children are born with cough. That one, I think, has been... Doctor, you talked of family planning. What is the best family planning method for women? And does wearing Pampers affect boys in any way? Okay, so doctor, after this, I'll give you one more set and we will be able to summarize. Over to you, and we are forever grateful to you. Over to you.
Wow, I feel as if I'm in an oral exam right here. But when do we introduce Pampers? I mean, sorry, gadgets. When should we introduce gadgets? I think today we have technology transfer and technologies overtaking everything. There's now ChatGPT 1, 2, 3, and 4. There's music on our phones. Our phones are now like little computers. And children can now even listen to music when they are in the womb. If a child listens to jazz and classical music, studies have shown that they are going to be very calm and composed children. If children listen to the father singing in a deep baritone voice, they will be connected to that father even before they give birth to the baby. So technology and gadgets are so much in between, but I assume the person who asked the question was talking about perhaps computers and phones. We know that this Z generation is cleverer than us. Believe it or not, a 2-year-old can open a phone, scroll, and get into a browsing space and look for their comic songs and nursery rhymes at 2 years. And yet some of us, our age group, the boom baby generation, maybe we first saw a computer when we had finished university. You know better. We need to be careful as we push gadgets into our children's faces. There are pros and there are cons. The pros are that as we expose our children to the World Wide Web, to gadgets, they are going to be more tech savvy. They are going to be more alert and understand the gadgets better. However, you have to remember that the brain of a child and the brain of an adolescent is not yet mature. They can be oversensitized and they may end up becoming addicted to those gadgets. And addiction to gadgets is real. That if a child gets hooked on, let's say, TikTok videos, or they get hooked on social media, they may not have the time or the brainwave to learn other things. We need to limit screen time and take the children out to see nature. We need to limit the amount of screen time that we are giving to the children so that they learn how to communicate with people. We are living in a space where we are socially disconnected, and COVID-19 made it even worse. The lockdown pushed our children into being on the computer, being on the phones, and not talking to other people. And this had a ripple effect in creating mental illness. And I'm not saying mental illness, they are throwing stones, they are undressing in public. No. Loneliness, depression, panic attacks are increased when people spend too much screen time as children and as adolescents. So we have to be careful. It's up to you. You have the money, you know how much money you have. If you have the money and you're able to buy your child a speaking computer, a speaking storybook, you must limit the time in which they are using that gadget. So the next question is on cramps. Cramps, as we know it, is painful periods. And it's just your uterus, which is a big muscle, contracting to push out the clots and the blood. And if you exercise routinely, you're going to lower your pain threshold. So doing sit-ups, doing your squats, doing your leg ups and aerobics is going to lower the pain threshold. There's nothing, or rather increase the pain threshold. There's nothing wrong with taking a painkiller for 2 days during your period. Because remember, it will be digested, it will be metabolized and get out of your body. Instead of suffering with a lot of pain and thinking you're macho, you're like Hercules, no. Take the pain medicine or use a hot water bottle to control some of the pain and get better. But cramps are nasty. They can make people lose work time. They can make women irritable. They can make people get so nauseated and because of the pain. And gentlemen in the room, if your wife or your girlfriend or your spouse is having cramps, give them girl foods. Buy for them a chocolate, an ice cream, massage them, give them space, support them, because menstruation and menstrual cramps can be painful. Omusuja gwa nakawere in medical language is called puerperosepsis. It can be very dangerous. So when a woman is pushing her baby, the whole uterus and the vessels are all opened up. And if there's an infection by any chance, it will go straight into the bloodstream. And that can cause a bad bacterial infection. How do you prevent it? By attending antenatal at least 8 times during the pregnancy and being screened for particularly group B streptococcus. But also delivering from a safe hospital, making sure that the healthcare provider who delivers you has clean hands, is aseptic, all those things. If you get a rise in temperature, it may be because you are dehydrated or you have an infection. But seek medical attention. If you get a rise in temperature soon after you have given birth. Thank you. ICPU Council, please continue to buy the ambulances, but also our call to action included breastfeeding points for the mothers. So cough below 5 years can be because of a viral infection, bacterial infection, or allergies. Many children have allergies and many children have asthma and they don't know. So if your child is coughing repeatedly, please visit a pediatrician so that they can support you to get treatment. What is the best family planning method? The best family planning method is the one that is accepted by the couple. You will be given advice, and the advice would include withdrawal, moonbeads. Those are non-medical methods, or barrier methods like using condoms or hormonal contraceptives. But whatever you choose, please discuss. Don't go and do it secretly from your spouse, because we've known some husbands who have literally cut out the implant from their wives, or they notice that the lady, they touch the strings and then sexual and gender-based violence starts. We don't want to get into that situation. Do Pampers cause infertility in men? The answer is no. Infertility, as I mentioned, is mostly caused by infection in the testes. And one of those infections is caused by mumps. Mumpsoclitis can actually cause infertility later on in life. So immunization of mumps is a very important tool or intervention that can reduce on the infertility later on in life. Thank you.
Thank you so much, Doctor, and you have elaborately attended to those questions. Yes, we have heard that at ICPAU, we shall work on that, and everybody has heard. And someone says, Joanne is saying that the friend is a first-time mother, and she has failed to love her own baby. How is it possible? She has failed to accept the fact that she gave birth. And so I think she's having some depression. And thank you very much. How about us who want to give birth to twins? When is the best time, I guess, to have dash? Okay, I guess she's saying when is the best time to conceive. She wants to give birth to twins. Yeah, doctor, these are accountants. You are going to give us calculations because that's what we understand most. And then, yeah, even Helen is asking, is there any way of having twins? Okay. Advice on how one can change sex. Okay. Yes. And re-emphasize on how a mother, an audit worker, a student, a minister in church, okay, yeah, can balance. So how a mother, a minister in church, and a wife can balance life, work-life balance. The next seminar, work-life balance is still necessary. I think people need this. And then the other one is asking, where can they find Dr. Sabrina? We are going to still share with you where she's very available. As I've told you, I have had a chance of talking to her with my teenage girls, and I think those were hours very well spent. Thank you, doctor, for this presentation. Some men have sneaked here and are taking, so this is a man, and he's saying, thank you, doctor, for this. Some men have sneaked here and are taking notes quietly. My question, they say Pampers affect the boy. You have already answered. Okay. Nicholas is asking, he's a man, doctor, how do we support our wives during menopause? So this is a very good man, Nicholas. That is good of you. He wants to support his wife during menopause. And how can one get rid of ovarian cysts and growing fibroids other than conceiving? Thank you. And yeah, doctor, that will be the last round of questions before we wind up.
Wow, those are really important questions and very interesting as well. So the pamper question we already answered, and this first-time mother who doesn't want to see her baby, it happens. There's a condition called puerperal psychosis or postpartum depression, and it can really make mothers angry with a baby. That is an emergency because mothers have been known to practice infanticide and hurt the baby or even kill the baby. So that mother needs to see her gynecologist, but also a psychiatrist to support her health, her mental health, and be assisted. With time, she will get to love the baby. Maybe she had a traumatic experience while becoming pregnant. I'm not sure. They need to be evaluated on an individual basis so that they can be assisted. I know Ugandans love titles. They want to be called Salongo, Nalongo, Sabalongo, all those words. But not everyone can carry twins. First of all, if you have twins in your family, especially the fraternal twins, that when you ovulate, each side of the ovaries brings an egg, then you're likely to have twins. But the identical twins, it just happens. It's just a lucky chance. I know that there's medicine now for increasing increasing ovulation, but I'm not going to share it on this group. Otherwise, people will be running to the pharmacist and asking for it. Please talk to your gynecologist if you desperately need to have a set of twins, and they will guide you on what to do. Work-life balance. You may be a minister and a great minister in church, but then you're not taking care of your children. And that means that you're not leaving a legacy. The best minister is one who leaves a legacy and makes sure that their home, that the prayer starts from home. Whatever we do, if you're a good accountant, teach your child financial discipline. Let your child not be the one who is blowing all the pocket money in one day. You have not done your work. If you are a doctor and your child is the one who is not vaccinated, your child is the one who doesn't know how to wash their hands before eating a meal, then you are not doing your work. I think that we all need to be selfish for once, and that you are not done if you have not taught your own children. So take this message seriously, that as we do our work, as we become celebrities in our workspace, your legacy will be if your own children can emulate you or do better than you. So do your best to balance between your work and your home, but be friends to your children. Thank you, gentlemen, for joining the group, and I'm glad that you're taking notes. How can you support your wife during menopause? And menopause is a huge topic. God created us so that during adolescence, we start our menstrual cycle. As we complete our reproductive cycle and become ready to become grandparents, the menstrual cycle stops and the eggs stop coming. And that is the time when we call menopause. If you have not had a period after the age of 41 onwards for a whole year, it means you have attained menopause. If you don't see a period for one whole year, please do not assume that you have reached menopause. I'm saying this again. There's a period called premenopausal period and also a period called menopause, when there are no more periods. Women have become surprised or shocked getting pregnant at the age of 52 when they should be starting to plan to become grandparents. So men, how can you support your wife during this period? First of all, think about contraception, because you might end up being an elderly daddy whose child will be calling you Jaja when you go to see them in nursery school. Not that it's a problem. Like I already said, men have their financial clocks. They can give birth at any one time, and it is okay. When women are going through menopause, they can be irritable, they can be dry, they can be having rashes, they can get hot flashes. So how can you help your wife? By understanding that her physiology is changing and communicate. But also men go through a period called andropause. That men who used to do a 100% salute, the salute starts going lower and lower, and their energy starts growing less. They get a lot of fat around their abdomens. How can you help yourself? By exercising, by seeing your doctor, making sure you communicate with your wife, and that your style of sexual activity may change a little bit to be able to engage you at your age. For whatever you do or think, please do not self-medicate on energy-enhancing drugs. Men have died in the process of trying to show that they are highly pro. And please don't be an example of people who die during the act. Thank you.
Okay, thank you so much, Doctor. You have really done us justice, and indeed we are very grateful that you have really answered most of the questions. This one of folic acid has been answered already, and yeah, indeed you have answered most of the questions.
Sorry,
Yeah.
I just want people to know, Gloria, that the folic acid is taken so that it prevents children from getting spina bifida and hydrocephalus, which is water in the brain. So when I say folic acid, it's just one of the supplements that a woman will be taking, but obviously she will be taking other supplements, including vitamin A, zinc, magnesium, to up her immunity. The other question I didn't answer was on cysts and fibroids. There's a saying, which is a myth, that if a woman doesn't carry a baby, she will get fibroids. But that's not always the case. So please regularly visit your gynecologist or your obstetrician to give you further advice. Thank you.
Okay, thank you. And yeah, so as we come to the close, you will tell you will actually let people know where they can get the book. Some of your books, most of them are asking about it. So they need to know where to get the book, and also how many come in. You have actually helped in advising us. We are really grateful. Joseph wants to see how do we as men have part in our own children's intelligence. Yeah, they have said 70%, Joseph. That 70% is from the women's intelligence. That is biologically. So you have a 30% that you can contribute. So to enhance, look at the intelligence, the intellectual capacity, not necessarily the education background, I guess. So I would like to, first of all, thank you, Dr. Sabrina. I would like to thank you. On average, we have been, at one point we hit 680, and now I can see we are 618. Thank you all for embracing us and coming to educate us on Women's Day, because as women, we have been reminded of our responsibilities. We've been reminded of what we need to play as a role as the family doctors and the doctors at home. And thank you, the men that have logged on behalf of your wives. And we know that you're going to be very good ambassadors. At this point, I would like to invite our CEO, CPA Derek Nkaja, to give closing remarks.
Thank you, CPA Gloria, our council member, Dr. Sabrina Chitaka. This is wonderful. And as I was listening, I was just saying, wow, the questions people are asking and the answers they are receiving were all interesting. As I do my remarks, I would say, on behalf of the Institute of Certified Public Accountants of Council, on behalf of the President of the Council, the President is a female, CPA Josephine Osia. Would like to thank you for offering your time, your expertise in really taking us through the woman as a family doctor. Indeed, we cannot say we have exhausted, so I would request that as we reflect on what we have learned today, that if the members ask for your uncle, you should be available to offer yourself again, because that's what we want to learn. We have as many, the profession has about 32% female in full membership. We have about the studentship, we have about 49% are female. And for those who have qualified, but they are not yet full members, about 46% are female. So there are quite a number of female in the accountancy profession, and we like to have them embrace their role as mothers, as women, at the same time as a professional accountants. And we are very, very grateful for your efforts. Now, as I also speak about the thank you remarks, I just want to alert all our female colleagues, the accountants, that we want to celebrate you, and there is a campaign throughout this month celebrating you, but we celebrate you by sharing your accomplishments. Please share what you do. We know that you are nurturers, you are an inspiration for others, unite others, and you are transformers of society. So please share whatever you, especially if you are, our team reaches out to you, share what you have with us, and we see how we can celebrate you through our tweets, our social media, and our other communication gadgets. Remember, in this new strategic plan, we know that accountants will create impact, and we want to see that impact of the women in accountancy across the way we have seen that our current president is a female, the president of PAFA is a female, CPA Keto Kayemba, the president of the African Federation of Institutes of Internal Auditors is also our female, the former vice president, CPL Ruth Doreen Mutebe. So we want to celebrate all the female accountants that are doing amazing things within our midst, and we see how we can promote the profession across. My call to you, all female ladies, please participate in the regional members networks. We want to nurture ourselves in the regions and promote the knowledge we have learned, even the knowledge of being mothers, doctors in our families. And so with those few remarks, I'd like to thank you once again, our participants, for being a very good, active audience, and our moderator, thank you for the wonderful work you have done. And Dr. Sabrina, we thank you and we wish you the best. Thank you for sharing all what you have for God and my country.
Thank you so much.
Yeah, thank you so much, CPA, Derek, and over to you, Ambrose.
Yeah, thank you so much, Chair. And thank you all. Let's meet next week. Please visit our website for upcoming CPD activities. We will be in Mbarara for a regional Western Week seminar on Friday, 15th March. I wish you a happy Women's Day. Goodbye.
Yeah, thank you. I can see the men are so grateful that they have attended. Thank you, men, for having attended this. And I hope that knowledge, you'll use it to support your daughters and your wives. You can now pour yourself a cup of coffee, and you also pay the bill. Bye.
All right, thank you. Chair, allow us end the event from here. We can end now.